So moving ahead with the day, we have our panel discussion placed in as the next session. We have both our panelists on the board. We have Dr. Vrajesh Udani and we have Dr. Avinash D'Souza. And the topic for our panel discussion today is fear of having second child. As we all are parents having children with special needs, so this is the question which someday or the other tries to bother us, that can I opt for a second child? Do I opt for a second child? How do I go ahead with? So our committee had thought to have a very offbeat discussion about this. We did not invite any of the biological professionals involved with childbirth or thinking about the second child. We have two diverse personalities, dynamic personalities with us. Dr. Rajesh Udani has a vast experience in the field of child neurology and epilepsy. Dr. Rajesh Udani has a vast wisdom in the field of child development. His affiliations are Comprehensive Epilepsy Center, Second Child Neurology, and PD Hinduja National Hospital. He is also consultant at BJ Wadia Hospital for Children, Mumbai. His qualifications are Pediatric Neurology, Clinical Neurophysiology from New York, USA, Epilepsy from Miami, USA. Positions held are President of AOCN 2016 to 2018. He was the President of CNG Mumbai and Organizing Chairperson of ICNC Mumbai 2018. Dr. Udani's personal interests are with respect to complex epilepsy, medical and surgical management, perinatal brain injury, and autoimmune neurological disorders. Dr. Udani has 81 paper publications in peer-reviewed journals, 24 book chapters, 6 orations overall. Welcome, Dr. Udani, to our panel discussion for today. Yeah.
Thank you so much, Dr. Asher. Thank you very much.
And we have Dr. Avinash D'Souza with us. He's a consultant psychiatrist and psychotherapist. He's consultant school psychiatrist as well. He is the founder trustee of D'Souza Foundation, very well-known foundation in Mumbai. It is the trust that works in the area of mental health awareness across all sectors. Dr. D'Souza is an associate professor and secretary of International Institute of Organizational Psychological Medicine, an organization that works in the field of organizational psychological medicine across 7 countries. He also is the international faculty for UNESCO, chair in bioethics, working in over 8 countries for the same. He is the chief editor, associate editor, and assistant editor in quite many journals associated with the field of mental health and psychiatry. Currently, he is also the advisor of the IPS task force dealing with school psychiatry, as well as chairperson for the IAPP, that is Indian Association of Private Psychiatry Committee for College Psychiatry. He's been working more than 35 years in this field. I would like to welcome Dr. Avinash D'Souza as well for the talk for us today. So I would just orient us. I would just have a quick orientation about the topic, fear of having second child. I would like to have kind of an opening statement from both our professionals. So Dr. Udani, can we have a small opening statement from you about this topic of fear of having a second child?
Yeah. See, every child, every special needs child will have parents who will be worried about this particular problem. And the question is that, are we justified in our fears? And second thing is, what exactly, it's a very complicated question, that whether you should have a second child or you shouldn't have a second child. But the only thing I want to emphasize is, it is the parent's decision. We medical professionals can guide you. We can tell you what the newest, the latest things are in technology, in genetics, to make sure you don't have a second child like this. But finally, the decision is of the parents, and that has to be understood by the parent. Because many parents come to me and they ask me to make the decision. And though there are certain biases which I have in my practice, it's obviously doesn't work for everybody. And that has to be understood by the parents themselves.
Correct. Definitely, there are a lot many biases involved in this question of having a second child, not going ahead with it, how to plan it out, and stuff like that. So, thank you so much for your opening statement, Dr. Dani. I would like to ask Dr. D'Souza to have an opening statement about this. Many parents might have consulted you for this question that, sir, we want to have a go at a second child as well. So, what is the entire mindset which goes behind this? Your opening statements, Dr. D'Souza.
Yes. Well, first of all, I definitely agree with what Dr. Udani has mentioned, that it's the parents' decision. It's not our decision at all.
Can't hear you very
And
well.
so I always tell them that. Am I audible? Somil, am I audible?
Yes, Dr. D'Souza, you're audible to me. Dr.
Yeah.
Udani, he's not audible to you?
It's okay. It doesn't matter. No problem.
Okay,
Maybe it's
okay.
my
Okay, sir.
So, like I said, I mean, I agree that it's the parents' decision. It's not our decision. And one of the things parents always come and ask me as a psychiatrist is that what if we do have a second child that is born with a disability? How many cases have you seen where this happens? And what is the risk? Now, invariably, sometimes we have genetic testing that tells us. I would say still half-heartedly, not always. We're not very sure even with that. Sometimes it can happen that we have cases wherein nothing happens, everything is fine, the second child is absolutely
Correct.
normal. Sometimes it also happens that yes, the second child is born with the disability again. Now, so what I normally do is I tell parents that why do you want a second child? I try to find out what their aspirations are. And the reason is, I think, very often very important, because if they very often say, no, we want a normal child, so we want to plan it, then I tell them you have to be very careful here. Whereas there are a group of parents I met who say, so jo bhi hoga bhi dekh lenge, manage kar lenge, we'll accept it as, what God wants for us or whatever in that sense, and we'll take it. So then that's a different approach. So I think what matters finally is why the parents want a child, a second child. There are various risk factors, and finally, of course, it's their own decision.
Great, Dr. D'Souza. So we have a couple of very insightful words with us. One is Dr. Udani's parents' decision. That is the utmost crucial key over here. And what Dr. D'Souza has to say is, why do the parents want to plan the second child? The basic purpose or the reason behind going ahead with planning of the second child. So on this note, we would like to quickly move on to the questionnaire which we have prepared for this panel. Yes, so Dr. Udani, the first question goes to you. Can we opt for the second child to benefit our first child? That is the most common question you might have received through your practice. So
It's a very complicated question. It seems simple, but it's really
Yes.
not.
yes,
Over here, there are two people who are involved in this. One is your special needs child. In fact,
Yes.
three. Two are both of you, the parents. And the third is the second child. The only people who have a say in this decision are you, the parents. Obviously, a special needs child often doesn't understand. So, and the important thing is that you have to therefore have a reason. So, one of the reasons I always, that's why I'm saying that you should understand why you want the child. Exactly what Dr. D'Souza said. Do you want the child only because you want to benefit the first child? Do you want a child because you want more children? I mean, all of us want more children. Do you want the child because it would be easier for you to sort of look forward in life because you have a normal child? There are many issues over here, and that first question has to be resolved. Now, what is my experience is that usually the second child benefits the first child greatly. I come to some caveats in later questions, which I know you've written down them, so I'll talk about it later. But usually, the second child's makes a lot of things go right for the family.
Okay.
The child, the one special needs child is not the only focus of the parents. He learns or she learns about socialization. There's a lot of camaraderie which occurs in the second child towards her brother or sister, and this generally helps in the long run. No question about it. Parents become happier. Now they accept much more readily the problem of the first child, because many parents, for years it is so disheartening that despite explanations and all that, they are going from doctor to different people, trying to get some medication which will cure their child. And even though, in heart of hearts, they know that. But this is the problem. So once you have a second child, acceptance of your child's problem, the developmental disability which he may, she may have, becomes easier. Once you accept that problem, and that becomes, because now you have something to look forward to. I mean, you have a lot to look forward to in a special needs kid also. But if you want to make your life more, if you want to have a second child yourself, it will help you to cope with the first one. But generally, my experience has been positive.
Wonderful, sir. Wonderful. So, with respect to your experience, you have positive experiences with the second child.
Can you hear me, by the way?
Yes, absolutely. Absolutely.
Okay.
We can hear you, sir.
Okay.
So, as per your experience, you said that your second child has mostly benefited in most of the cases for the first child. And a very important statement, sir, you have made that the acceptance of the problems of my first child becomes a bit more easier for the parents. So, Dr. D'Souza, is this the exact scenario which you will also support with, that the acceptance becomes a bit easier with the second child into picture?
I totally agree with what Dr. Dani has mentioned, but I think I will also say something here that I've often seen that while if you have a second child and the second child is born healthy and there isn't any problem, very often what happens is that the second child gets a lot more attention from the parents, being the healthy child. And I've seen cases where they then tend to neglect the child that has disabilities because their focus shifts to the child who's doing well in a mainstream school. And so invariably what happens is by the time their second child reaches the 7th, 8th, 9th, 10th standard, you have this the special child is much older. He also needs their attention. But then what happens is that invariably there are issues when it comes to managing the special child and the other child. And I feel at times then the special child gets a bit neglected. This would be my add-on. Otherwise, I agree with everything what Dr. Dani has mentioned.
Okay. I would just like to ask the audience whether Dr. D'Souza is audible, because I am able to hear him. I'm not sure if others are able to. Dr. Udani, how is it for you?
I can hear you fine, but Dr. D'Souza is a little less audible. Yes.
Okay, yeah, a little less audible.
Yeah, bit low voice actually.
I believe I have the earphones very close to my ears. That is why I'm able to hear him perfectly.
Even I have, but bit low. I think, sir, you just have to be a bit loud.
Dr. D'Souza, can anything happen from your end? Some kind of a change of device or something?
Is it better now?
Yes.
Yes. Absolutely, sir. This is much better.
Okay.
Yes. Dr. D'Souza, can you say something?
Yeah. Hello.
Yeah. This good. This good. This surely good. Yes. So, sir, very important point which you made is the special child gets neglected. My question was going to be completely contradictory on this in the later on section of our questionnaire. That generally what happens is the special child gets continuous attention and just because that is the center of our attention, my special child, and benefiting with the second child. So I have come across many scenarios wherein the second child, who is the healthy child, who is the very neurotypical child, gets also neglected. So I definitely have a share of a different opinion on this note, Dr. D'Souza, with you. But I would like to ask Dr. Udani about this, sir. Has this point come across your observation, sir?
Well, that's the whole thing, that it can go either way.
Yes, yes.
Many people don't want to have a second child primarily because they think that their focus will shift, and because they will neglect the first child, the special needs baby.
Yes, yes.
On the other hand, the other thing is also true. That's the big caveat I was saying, that you have a child who's born, the second child, and your motivation has unfortunately been that he should look after my first child. In case, I think I've seen those questions. If you want, if I amalgamate a few of those answers together, it may be useful for you. But basically, the motivation has to be very clear. You should want the second child for him or herself.
Wonderful.
And
wonderful,
not
sir.
for looking after, not for anything of that sort. See, if you're keen to have a child, if you're keen because you want more kids, everybody wants kids. So everybody wants, a large family. Some people don't. But, and that if that is very clear, that I want a family of at least 2, maybe 3. And the first kid or the second kid or first kid obviously is a special kid. You want to make sure the second and third doesn't have. That is very, very sensible. You must go all out for that. And we'll talk about that in subsequent questions. But in general, the motivation should be you want the second child. It should not be any other motivation. Because if you don't want it, and this, then it might be that you put too much responsibility on the second child, too much pressure. Also, there's a kind of, there are lots of things. You'll have to give enough time. There has to be time management. You give your special kid will get less time, yes.
True.
But that time will be supplemented by the sister or brother he will have.
Yes.
That can be supplemented by other things in the early part.
Yes.
So that has to be understood. Because I've seen scores of, children who they are neglected. Second kid is poor thing is neglected. Everything is about the first kid. Everything, the whole family life rotates around the first kid. And that is not right either. So you have to give equal time, you have to give equal love, you have to give, so that is very important, sir. I think that's
true, Dr. Dani. So you try to mention that the justice should be there for both the children, not just for one.
Correct.
Child.
Absolutely.
Yes. Wonderful, sir. Wonderful. So moving on to the next question. Is there anything we can do to prevent any issues in my second child, or will my second child also succumb to any kind of developmental disabilities? Question again goes to you, Dr. Udani, first. Any kind of precautions do we need to take before planning out for the second child?
Yes. First, let me just clarify a few things. Now, I don't know how. I'm sure much of your audience may find my answer a bit, basic. But I'm just talking about, what experience I have over the years. Okay. And many parents ask me questions which, you expect that they will know, but they don't. So I have to answer. Developmental issues are caused by numerous reasons. There are different types of developmental issues. You have, something which causes a motor problem, like, for example, what is commonly called cerebral palsy. You may have social and language issues, which may be because of autism or, intellectual disability. There may be other problems like learning issues because of learning disorders. You may have many, many issues. Each of these issues, in turn, most of these issues, before I go to the next thing, most of these issues are caused by brain issues. So the brain is dysfunctional, diseased, damaged, or what have you. But all of that can happen and cause these same symptoms. So the next question is, if the brain is the main thing, we have to find out what exactly is the diagnosis of your child. Saying somebody is autistic may not be enough. Saying somebody has cerebral palsy may not be enough. There has to be a reason for it. And the reason basically depends on, it could have happened before birth. It could have happened during the process of birth, a couple of weeks before, maybe a little later. Oh, sorry. Am I muted?
Yes, now you are unmuted, sir.
Okay, so you have to understand that. So once we find out if there is something happening before birth, one of the reasons could be a genetic.
Correct.
And there are many reasons which are acquired. So the acquired conditions, for example, things which happen around time of birth, the things which happen after birth, most of the things, many of the things even before birth, may be acquired because of various other factors and may have nothing to do with genetics at all. So there is no real reason for your chance of having a developmental issues in your second child if it's an acquired cause. Now, genetic causes also is very complicated. When we say genetic people understand inherited. Genetic is a lot of connotations. Genetic may be, yes, it may be actually inherited, or it may not be inherited, or there may be many factors besides the genetics. So genetics may be a small part of the problem. There may be a lot of environmental factors which might affect the development. So all these things, and some of the times you may have abnormalities in genes in the tests you do, which may or may not be expressed in the second child. So this is a very complicated problem, and the only way you can address the problem is if you know the exact diagnosis. If I know the diagnosis is A, B, or C, then I can give you different counseling for that particular child.
Correct.
It is not just the developmental issues, can be all are similar and all have the same risk. So you have to try to achieve the diagnosis. And just one thing before I finish, people ask me very often, can you help my child if I do this, if I do this, if I do this? And I said, no, I may not be able to help your child if I do all these tests. But I'll tell you one thing, it will all make you plan better for the future.
Correct. Okay. Dr. D'Souza, I would like to quickly ask you one question, sir. There are many times these mindsets coming into picture that will the issues in my first child have any kind of negative impact in the upbringing of my second child? So have you come across these kind of queries, sir?
Well, yes, this very often happens because we get parents who come and say that I have a child who has epilepsy or who's aggressive, or I have a child whose speech is defective. And when I have a second child who hears my first child speak like that, will he imitate him? Will he behave like him? Will he pick up the aggression from him? This very often comes up. It also comes up that they very often say that will he pick up the mannerisms and the stereotypical behavior that this child is showing, and it would probably influence his early development. So should we keep them away from each other, close to each other? This is something which they very often ask. And I always tell them that I think each child is different. Each child develops on his own. And as parents, your parenting, of course, would vary a little because you're dealing with a child that is developing normally versus a child who is special or has special needs. So you'll definitely spend probably there'll be differences in your caretaking process or in the way you deal or handle the child. So as long as you deal with your child normally, talk to him normally, and you will have to have maybe as I say minor differences in your parenting skills when it comes to dealing with both the children. And this is particularly so if the age difference between the two children are not very much and they're both developing together. If of course you have one who's older and one who's younger, then you definitely have to make that transit. And I say a lot of parents do it otherwise also. So it's not difficult. A lot of parents do it. So there's no reason why you can't do it here. But picking up behavior, or I think the first child causing a change in personality of the second child, I don't think it ever happens. In fact, when they grow together, there is more acceptance, there's more love. It's only at a later stage, probably when they are older, maybe as teenagers or as young adults, that sometimes differences in thinking may come up. But at a young age, we haven't seen really major issues.
Yes, yes, wonderful, sir. So we can claim that no negative impacts, definitely, but if the child is going good with respect to a minor age difference, there definitely will be positive impacts on the first child with the second child, and the upbringing will go hand in hand at that point of time. So quickly, I would just like to again ask you the same question I asked Dr. Udani. Apart from the organic issues or organic problems while conceiving the child, are there any other issues, or are there any other things which we need to take care, might be during the first trimester, second trimester, or while conceiving?
Okay. So I think, in keeping with what Dr. Udani mentioned, my take has always been that I first ask them, why did the first child develop a problem? So if they very often come and tell me that, so there was a head injury, there was an accident that led to this, then obviously that's an acquired cause. So we don't need to really worry here in this case. Secondly, if they probably come and tell me that he developed an infection that led to some brain infection like meningitis or encephalitis or whatever, then obviously again that's a cause which is not totally genetic. So it's not something that, may happen to the second child. If the mother had pregnancy related complications, and I tell them the gynac has to be very careful to sort of try and see that those complications don't happen right from the first month of pregnancy. So if there was some diabetes, some eclampsia, something that led to the child suffering. But as Dr. Udani said, if it's genetic and there are genetic factors, or the child has been born with a developmental disability and we're not able to pinpoint the cause, then it's very complex to tell them, what are the chances for and against. And I think Dr. Udani sir will agree with me. We've had many parents who come and tell us, agar aap mere jagah hote to aap kya karte? They invariably ask you that kind of a question. And we always tell them, see, it's not about what I would have done. It's about what you would want to do. And these are your risks, these are your differences, and this is how, you have to now take a call. And they very often, say ki, understand that this child's mother is like your sister, please take the decision, and we very often have to tell them, no, it's not our decision. So, but yes, if there are acquired causes, the risk is of course far less. But if there are genetic causes, then we really don't know. I mean, the risk is always there. It's quantified by studies, but we really can't pinpoint and say, there is a chance, better chance or a lesser chance, and go by that.
Correct. Dr. Udani, one thing what Dr. D'Souza mentioned is there is some kind of a mild change in parenting with respect to my first child and the second child. Have you observed or come across?
Can I go back to the, because I think
Sure.
you did not finish the genetic thing. So let me explain this. For example,
Sure.
let's take a condition which is which is basically seen in consanguinity. Consanguinity is when you marry cousins and you marry uncles and that kind of stuff.
Yes.
These conditions are generally very inheritable. They usually present, and there are simple tests nowadays available to come to a diagnosis. There, besides all your MRIs and this and that, and these can be easily found out. You are called monogenic disorder. So one gene is responsible. There are many of them. And you can find out this by doing a simple. You must, of course, diagnose this in the index patient, and then afterwards you basically use the same test in the pregnancy, in the first 3 months or so of pregnancy. In a simple test, you get the test done. In 2 weeks, you have the answer whether your second child has the problem or doesn't have the problem. Simple.
Yes.
The second group of diseases, what are called polygenic or multifactorial diseases. Now, somebody had a question, I was looking at the chat box, about the autism. So we know that autism definitely has susceptibility genes. So genes which actually just give you a tendency to have that.
Okay.
And there are some genes which are But the problem with autism is the risk of recurrence is so wide. Studies have shown, anywhere between 4% to 18% in the second child. And the problem is that if you do genetic testing in autism also, to find an actual cause which you can help in prenatal diagnosis, that means making the diagnosis in the second child before birth, is low because the genes are too many. There's a susceptibility factor. There's also this environmental things which can change and all that. So it's very difficult to come to a definitive conclusion and tell you that this is the risk in the second child. So you can give you approximate risk. Say if you have a girl with autism, then the risk is higher in the next sim. If you have a boy with autism, the risk is lower. In the sense, because the girls, so of course the males get more autism than girls, but if the girl has autism, then the chances of a boy getting is higher. And about how much is higher? Well, it's between 7% to 15-16%. Now, you can say that's a lot. Yes, that is a lot. But at the same time, look at the other side. There's an 85 to 95% chance or 90% chance that he won't get. So this is the, and therefore this risk has to be understood. This has to be communicated and understood. And we can help you in doing all tests and all that. But finally, the decision will come, should I take this chance or not?
Yes, yes. Wonderful statistics you have given, sir, that 85% is what we should be looking ahead rather than getting disheartened or disappointed by the 7 to 15%. Wonderful observation also over here. Dr. D'Souza, anything to mention with respect to the mentality, how generally the humans think over here, the mindset? Like we always look for that risk factor, even if it is 0.01%, and we are always confused or getting stuck over that 0.01%. You will have to unmute yourself, sir.
I think there are three types of or four types of scenarios that we get. One is you have a parent who will say, sir, even if there's a 5% risk or a 10% risk, I don't want to go for a second child. The second is the opposite scenario, which Dr. Udani mentioned, that yes, they say that means there is probably an 80%, 70% chance that it won't happen. So I'm willing to take that risk. We have a third parent who says that we'll go ahead, we'll see what happens. And whatever it is, we accept it as our fate. So they're open. And you have the fourth who say that, no, I want a second child. It doesn't matter whatever may be the outcome, and their need for a second child is far more. And they say, go ahead. We really don't care. Now, if it is, so I've had parents have said, what if the second child is special? Have you thought about it? So they said, we already have the experience of managing one, we'll manage another. They come up with that kind of an optimism. And they say, if it doesn't happen, then we're very lucky. So either way, we are positive. So it varies. So you have 4 or 5 different scenarios that can come up.
Wonderful, wonderful comparison, sir. One is who are not going to take even a small amount of risk. The other factor is that they might take risk. The third is they might take the risk also, and they might accept as well. And the fourth type of person you said is who has made the decision, I want to actually go ahead with my second child. So that's a very wonderful statistics which you have given, sir. Thank you so much over this, Dr. D'Souza. I will move on to the next question in our questionnaire. Very common question again, will my second child take care of my firstborn after I leave the world? Because many a times this query kind of worries all the parents that मेरे जाने के बाद मेरे बच्चे का क्या, तो मेरे जाने के बाद मेरे बच्चे को प्रॉब्लम ना हो इसीलिए मेरा दूसरा बच्चा उसको मदद करेगा मेरे पहले बच्चे को. So what is your take over this, Dr. D'Souza?
Well, I always tell parents that there are no guarantees in life about anything. That's enough. So your second child, if let's say he develops normally, he gets married, he has his own family, we don't know how his spouse may behave towards the special child who becomes an adult by that time. We don't know how his children may look at their uncle who is special. So we really can't say, and he may be under pressure from his wife and spouse that we're not going to have him with us and we can't look after him. These scenarios happen. I've had a number of times adults brought to me with disabilities wherein the brother says, he's my brother and I want to love him and look after him, but so my wife doesn't want to, have him around, or my children say we don't want him around because sometimes his behavior gets a little difficult. And I have grown up with him, I love him, but I still need to probably put him up in a home somewhere or put him because my family just can't manage him. Till my parents were there, things were fine, but now it's going to get difficult. The other issue that also comes up is that I always tell parents, bring up both of them together. From a young age, inculcate into the other child that, this is someone who you have to look after for life. In fact, even if you don't look after us as parents, you have to look after him. So there are many children who I think till the last moment take care of their special siblings, and there are some who I think are only waiting that they no longer have this responsibility. I'm sorry to sound blunt, but that's the way it is, and they are very happy to put away their special sibling into a home and pay some money every month to have them looked after, but they don't go and see them. So I think it all depends on the amount of emotional attachment the sibling has while growing up. But then all that also changes with time, with the sibling having his own family and other pressures that come up. So, I mean, if you look at it from different scenarios, well, ethically, morally, he should look after him. But then, you can't blame him also. He has his own family and his own responsibilities. And this particularly even happens when you have a sister who's, married and in another house, and she says, my husband doesn't like the fact that the whole time I'm going to my house to, look after him and do this. He always says that, you're neglecting our house. So it becomes very difficult.
Yes, sir. That is quite.
Can I add a little bit over here?
Yes, sure.
On the same thing. I mean, I agree with Dr. D'Souza fully. What I have found is that the way a second child should be brought up, in case you have a second child, is that he should not be he should treat his younger brother or older brother as a regular sib. You should accept your child's disability and show him off to the world. So if the parents accept, the child accepts. If you give equal time and while they're growing up, as I agree with Dr. D'Souza, love is what is there finally between sibs and what remains. The second thing I wanted to say was that, there is a big problem in those who are finally look after the second child, but can't stop looking after him. So I remember a case I had many years ago. This was a 25-year-old, fairly unfortunately wheelchair-bound disabled man who was about 22, 23. His older sisters, two of them, one was 40, one was around 25, 30 or whatever. Both were unmarried, both were looking after the parents, after the child. Over many years I followed them up, and basically they didn't have a life after that. So it is, you realize that they've missed a lot of life too. And that's why this is a, kind of a two-way sword. I mean, it can fall either way. But most of the times, I think, if you accept your kid's disability very, very easily, your child accepts it, love and all that. And most of the times, if you, as somebody was talking in the last panel discussion, you have trusts and you have trustees and you have, and even if you have to, you don't have to have somebody, you can have some caretaker who can look after, in case your sib at the brother or sister at the later stage can't do it. So I think all those things need to be taken into account to make a decision.
That was where I was going to come back to you on the acceptance note, Dr. Udani, that yes, this acceptance has to be innate first with the parents, then transferred out to the children and to the other siblings and to the other family members or to the other neighbors and every relative and every person in the community and society as such. Wonderful thoughts over this, sir. I guess I missed out one of the questions I had asked him. Just going back to that question, just give me a second, sir. Okay, I'll go ahead with the next question. Many times, this might be the scenario in front of you, experienced people and professionals, that the questions asked are to a different kind of a professional. Like a question with respect to the mindset might be asked to you, Dr. Udani, being a neurologist, and might be kind of an organic question might have been asked to Dr. D'Souza. So at this point of times, how do you handle those kind of queries of our parents with respect to this topic of second child?
You're absolutely right. I mean, unfortunately, neurologists and generally medical practitioners, and I'm not talking about mental health people,
yes,
they sort of don't understand and don't give as much importance to explaining these other issues during their quick consultations. Frankly, I am also been guilty of that. I absolutely think it's just not enough time to explain all the issues. But generally, much of what I'm saying and what Dr. Avinash is saying has common sense. It's not something which is what is important is, I mean, all of us as parents, when we go as parents, why do we become parents? We want children. We want to, and if we don't, and sometimes we are not as, I won't use the word disappointed, but you feel that something has happened, you have a special needs kid, you see what happened, you blame yourself. So you go through that cycle of, denial, grief, and finally acceptance. And the faster you reach the acceptance category, so that's what I try to tell them. The easier, if you're not ashamed of your kid, and I'm sure most of you in this group is not, because you're having a summit on this. But believe me, in the population at large, many parents don't talk about their child, don't talk about what happened, to their friends and all that. We had a survey done on the knowledge, attitudes, and parents in Hinduja Hospital by my student, and she actually asked these questions to all parents of children with developmental delays who came to us and intellectual disabilities. And surprisingly, many of them would not tell their family. Not family members usually know because they live in joint families, or but friends are unaware, or at least less aware of what the problems are. So I think if you treat them, I mean, I always remember one friend of mine who has a special kid, a brother. Their mother used to always tell them, wherever you go, you take the kid with you. And that was, they all love him, everybody, he's perfectly fine now. It's really something which is, you have to accept. And once you accept, I think your child will accept, and everything should be much better.
Any takes on this, Dr. D'Souza, from your end, that wherever you go, you take your child along with you, you make the child as social as possible?
Yes, I definitely agree, because I think the more you normalize the condition that the child has, the more I think acceptance comes in with everyone. And I will, I always, I agree with Dr. Danin. I think one of the things which, your earlier question that you said, questions regarding the organicity being asked to me and the mindset being asked to him, I think that's very common, because people, come to all of us, not only just Dr. Dani and me, all doctors thinking we're doctors, and we are supposed to know everything, in that sense, and that, you're the one who's going to give them a solution to all their problems. So they very often, and they also like to take diverse opinions. So they take opinions from 3 or 4 professionals before they decide on what they want to do. But I think, yes, taking the child everywhere is very important. I tell parents he will probably create a ruckus sometimes. He may get upset. He may, drop a few things. Let that not deter you, from taking him anywhere. And let it not be, a cause of concern or worry or whatever. And it's, absolutely fine. I always remember, a personal experience that I will share, that I was traveling once abroad and they had a child with Down syndrome on the flight. And the child was getting a bit restless and worried. And the air hostess said, "Is there anybody who can help?" And I said, I'm a doctor, but I can only probably talk to the child, see what's what. I really can't do anything much. So she said, "Can I bring the child to sit next to you?" I said, "That's absolutely fine. You can do that." And the parents were supportive. They said, "We don't want to disturb you for the entire journey, but at least till the plane takes off, because once it takes off, then he's, stable or whatever." So, so I, started drawing something on a paper and told him, you also draw or whatever. And the plane took off and he was diverted, and then they went back to their seats. So I think if people, and it was not something that I learned in the medical field to do. All I did was just distracted him. So I think this is something which, if people, rather than look at him and say, "Oh, he's on the flight, we're not going to get to sleep and we're going to get," if people were far more accepting. So I think what's very important is parents are already upbeat. They're very positive about their children. It's the general population that needs to get positive and aware.
Yes.
Correct. So as Dr. Udani also mentioned, that it is that normacity or the normalization, as you also said, Dr. D'Souza, that we show in our approach, and whatever Dr. Udani also said, that whatever we are talking right now is most of the logic part. It's not that very technical part which we are talking. We are talking based on our experiences. We are rationalizing the topic. We're trying to put few perspectives in front of parents based on our past experiences, and that is what is going to help them in their decision making, and kind of definitely not make a decision for them, but it will help them to go ahead towards the decision, closer to the decision. So Dr. Udani, my next question is for you. How much gap should be considered in between my first child with special needs and the next child? Now, as you mentioned that there are various categories, might be neurodevelopmental disorders, might be physical motor disorders or disability, genetic disorders can be the scenario. So do we need to have some kind of a gap in between conceiving the second child?
See, in typically developing children, I'm talking of just the normal population. Most pediatricians would advise you that the best is about a 2 to 3 year gap between pregnancies. It's good for the mother, it's good for the baby, it's good because the first 3 years of your life, especially, is very important for language development, so you can give a lot of time to your baby, etc. So 3 years, 2 years, 3 years is first. The second issue is, what is the ideal age? So it depends on when the patient comes to you. For example, if you have older parents, that time may not be as generous, so that you have to understand that the best age of getting a kid actually is 25 to 35. And with the way things are moving nowadays, people are having a 35, 37, 38. The older you get, unfortunately, these problems might crop up a little more. Of course, there are many things we should need to do during pregnancy to prevent that, but I'm just saying generally. So I think in a developmentally disabled child, I would probably give a little more time. 2 years is a bit too short. So I would say, especially if there is, we have if the parents are younger and they have still a lot of time, then I would give 3-4 years. Because by that time, you have an idea of where your child will be. Those 4 years will give you enough time to accept the problem, to understand the problem, to search for treatments, to get your investigations done, whatever it is. All those questions will be in your mind. But don't keep it for too long. Because once you cross a certain age, then it becomes even dangerous for the mother to have a kid. So I have a 43-year-old mother, 45 or 48-year-old father coming, ki abhi karu or not. I would say there are a large number of kids waiting to be adopted. large number of kids. I mean, everybody wants a good home. I mean, if you just want to give love, maybe that's the way you should give it. So I think this is important but usually I would say 3 to 4 years at least between children.
Yes, so 3 to 4 years gap is advisable so that you will be able to well understand the situation of
Correct.
your first child with
Correct.
special needs, and then take on the decision pretty well and go ahead with that. Might help you. The time might help you to take the decision also ahead. Also, the new insight which you got into picture of having adopted a child. There are many parents who also think of adopting a second child. Like this goes very much with our topic of adaptation. So, Dr. D'Souza, I would like to ask you the dynamics behind adopting a child. If you're thinking for your first special child, are there any different dynamics involved behind this?
Okay, now there are again, I would say 4 or 5 scenarios that come to the fore. One is you're lucky if you adopt a child, the child is fine, there are no problems, the child grows well, takes care of the special child. That's the ideal scenario, that your family is happy. In real life, we've seen many children being brought to us at 12, 13, 14, 15 with a lot of behavioral issues. These I'm talking about typically normally developing children who are brought to us with a huge amount of behavioral issues, anger, self-injury, multiple things. And the parents often say, he's adopted or she's adopted, and they say, in our family, no one has had these issues. Do you think this has come up because he's not our child and we don't know what the genes are or what the genetics are? And I've had many parents who, when they're faced with behavioral issues in their children who are adopted, and particularly the children by that time come to know they are adopted, so they even tend to use that at times against their own parents, that I'm not your child, so you treat me this way or that way, and all those kind of issues come up. I'm not at all here mentioning anything with regard to the special child. I'm just talking about the second child that's adopted. So you have many parents who then do a rethink, did we make a mistake, and you also have a group of children, parents who say, we don't mind adoption, but then at the end of the day, he's not our child. It's a child which is someone else's who is just taking up. We want our own child. That's so then of course adoption gets ruled out. But yes, adoption is an option, but they also have to be ready for all the challenges that come with it, and they have to accept all the challenges that come with it, which very often is seen. So I remember a child brought to me who was adopted and was very aggressive, and the parents told me, do you think this aggression could stem from a psychiatric problem in the parents, and that's why probably he was put up for adoption, which and I said it could be, but let's not go in that direction and let our mind think negative. Let's look at treating this child. That's more important. But so these issues, do come up, and of course, I always tell parents that you don't have a choice. But I want this baby or that baby, or those kind of things. So you can't really say. And there's in adoption, I always tell parents, you can't go back after a few years and say, we don't like this child anymore, so we want to now replace it with something else. No, I said those options aren't available. So prior to adoption, a lot of counseling for the parents is very, very important to understand what they're getting into. See, till the child is a baby, till the child is 5 or 6 years old, it's all fun. It's only later when the child starts developing and maybe certain problems ensue that the worry comes up. So I think parents need to be counseled about everything in the long run.
True. And most of the times, those are the early childhood issues which are kind of resulting in the aggressive or the rebel behavior. Is it your observation?
See, we really don't know, what had happened at the time of birth because records aren't available. We really don't know what were the psychiatric issues in parents of this child who was put up for adoption. We don't know why the child was put up. So there are multiple factors. So we really can't pinpoint and say, yes, this is all biological. No, it's really difficult to say. So we don't know. So those are gray areas rather, which we find difficult to answer.
True. Yes, Daniel.
I just want to make a point on this. I think one of my observations is Adoption is also often a secret. So of course you must be counseled, you must be talked to in detail about everything. You must be ready to accept the adopted child as your own child because you want children. He should not be, or she should not be brought in as a caretaker for your first child.
Yes.
That should be absolutely true. I mean, that should be absolutely understood.
Yes.
Once you've done that, then the second thing is, when do you adopt? You never adopt at birth. It's the worst thing to do. You try and adopt at about 5-6 months. You don't adopt too late either. Because after the age of 1 year, bonding becomes a problem. So the bonding which occurs is between 4 to 6, 7 months. This is the time when most kids can be checked for their developmental milestones.
Yes.
Where they can actually be, seen by a good neurologist, developmental pediatrician, or somebody who knows about development, and who can tell you that looks like this is fairly. Now there may be some behavior problems which might come up, but behavior problems, other problems can come up with your own children as well.
Absolutely.
They can come with typically developing children. वो तो अपने सबका जो भी, that is not in our hands. And most of the times, I don't think it is because of. But so this is important. Try and adopt a little later. And number 2 is, if you adopt, this is of course we're digressing a bit from the actual topic, but if you do adopt, please make sure the child knows that he's adopted. You don't have to tell him one day and make him sit down and all, but you should not find out later on, because that's a major issue. So over time, news should be broken to him or her. So he should be, as you grow up that way,
Yes.
So I think that's important. Those 2 things are important if you're thinking of adopting.
Yes. Wonderful. Very nice insights on adoption, Dr. Rani. Thank you so much. I just could recollect the question which I had asked you. Dr. D'Souza had made a point of slight difference in the parenting of both the children. The first child with few issues and the second child, there has to be some kind of a minor parenting changes. That is what Dr. D'Souza had told us earlier. Your views over this, Dr. Rani?
I don't remember exactly what he said because that was a while back.
No. I will just say, I didn't mention parenting change. What I mentioned was that, when you're parenting a special child versus parenting a child that's developing typically, your parenting style is a little different.
Absolutely.
Yeah.
That's absolutely true. Absolutely true. I mean, if you have a child with autism, just, he doesn't understand punishment. He doesn't understand all those things. He understands reward much better.
Yes.
If you have a typically developing child, he does understand punishment. I don't mean corporate punishment and all that. I just mean deprivation, that kind of thing, disciplining him, go and stand in the corner kind of things with the young ones, or no TV time today, or whatever it is. But those things to adjust the parenting skills finally, and that will may work. The punishment will definitely not work in the specially able child. But in the other one, definitely it will work. So there will be a little difference, yes. But the typically developing child, the second one, must be disciplined and everything in the same way, loved in the same way, everything exactly like a normally. Suppose your first child was normal, how would you parent them? One of the things which is always the most important job we do in our life is parenting. And unfortunately, nobody teaches us that before we become parents. I mean, that's and for a person with a special needs child as a first child, it's even more of a problem. I think parenting skills, of course, you learn over time, but there will be a difference between the 2 years.
Okay, sir. We have the next question, which I'm going to ask to both of you, doctors, that do you have any previous experiences where the second child supported the development of the first child? Any personal experiences you would like to share throughout your case studies? Anybody can go ahead.
Okay. Well, see, I know of the second child being very supportive. Definitely. I've had children who've been very protective. I've had children who've been, helping this child if there was any bullying happening, helping this child in a social situation, even taking him out with his own friends and making him acceptable in a group. So there have been multiple things that are definitely positive. I think I've also had instances where the child has, made this special child as a teenager, see a disco, a social, multiple things so that the child doesn't feel left out. So all those things do happen. So I think, yes, positive experiences, plenty, where the second child has been very supportive. Definitely, no doubt.
Yeah.
Correct, correct.
I mean, I'll tell you two experiences. One, the experience I already told you, where the sisters were looking after their disabled brother much beyond the call of, what we expect. In fact, they had actually, two of the sisters were unmarried. They were not really doing anything except looking after their kids. One kid is now, the kid is now 35, 40 years old. He's got epilepsy and all these problems. The sister is about 50 or so. She's still looking after him. The father has passed away. So you can imagine the amount of sacrifice, which is, and I think that's a little unfair to the girl. That's one side. The other side is a brother who I know. I mean, the brother of a disabled man now, because I've been following them for 30 years. And this boy cannot sit, walk. He has significant cerebral palsy and all that. And he comes for regular follow-up. I mean, from Ulhasnagar to me. And, for his epilepsy and all that. And his mother and father have stopped coming years ago. Now it is a brother who's taken over along with his wife. And, I was absolutely amazed. Every time he gets a seizure, the brother is so upset by it. He actually, messages me and calls me and tells me, do something, that kind of thing. So much concern. So I think supporting, they love their kids the same way as they love other brothers and sisters. And there are, of course, few examples where they want to run away, like Dr. D'Souza said. This happens a lot in other in other countries, Western countries and all that. Much less over here. Over here, the sense of responsibility, I think, is probably more, maybe sometimes too much. But therefore, I think it's very important to financially plan. They can go either way, and therefore you must plan for financially. You must plan about who's going to look after. And if it is not there, suppose that person cannot look after. What should the plan be? All those things should be planned before. Absolutely, that is the most important thing.
Yes. True. So a lot of planning and a lot of things will come into picture. Different kind of aspects are going to come into picture while planning the second child. That is what your opinion is, Dr. Udani. Thank you for your wonderful insights, both the professionals, Dr. D'Souza and Dr. Udani. I'm so glad that we had a very healthy discussions about lot many aspects and lot many queries. We have few queries in the chat box as well. Hope you both don't mind me taking those queries.
Sure, please.
Yes.
Please take them up.
Sure. So I have a 5.8-year-old boy with Fragile X and autism. And now I have 3 months old boy. I have done all the genetic testing and gone through CVS, and also we are consanguineous couple. But I know second child doesn't have Fragile X, but how can I go about autism? Will my second child be affected or not? As doctors have said, there are no problems except for heterozygosity in chromosome 22 that also they said asymptomatic. So should I be worried about the autism of my child?
How old is the second child?
Right now, 3 months old.
Oh, 3 months. So I think consanguinity has little to do with Fragile X. So that's most likely, stranger things can happen, but generally Fragile X doesn't occur in the context of consanguinity. Now, when you do genetic tests and you find all these kind of changes, you cannot predict anything. So so I would not use the first child's diagnosis and think that my second child may be different.
Yes.
So I think he'll be fine. Only thing is, remember one thing, environmental factors, if you're worried about autism, environmental factors are very prominent in that. Make sure interaction with your kid in the first 2 years. Don't give him mobiles and TVs and iPads, and don't, all those things which are important, which negatively impact your child's language and social development should be. It's like, if you have suppose this patient's first child was autistic, not Fragile X, but if your first child was autistic, then the second child, even if he has got some genes which might give him a propensity to have autism, if you avoid the environmental factors, he might never show any signs of that.
True. Yes. Dr. D'Souza, I would just like to ask you one very simple question over here. When Dr. Udani claimed that definitely there have to be no tests or something particular, a structure for guiding the diagnosis of autism, are there anything psychological assessments or something which might help us to keep a check over the developmental milestone? Would you like to?
No, I think again, there are no specific tests per se. You can, there are infant development scales, there are, scales of motor development that you keep a track with. But beyond that, I mean, they're known as the Bailey scales or the Gessel's developmental schedule. There are multiple scales which are used, but there's nothing really specific that, we can pinpoint that, yes, there's a risk of autism happening. No, that I don't think there is. I mean, we just have to evaluate month by month. And as he mentioned, I totally agree. Don't decrease social interaction. Keep a lot of social interaction, and environmental factors play a huge role.
Yes. Okay. We have another personal question in the chat box, which says, I have 6.5 years autistic son. My husband is suffering from delusional disorder. Can we plan for second child? Please guide.
Yeah, sir, please.
Go ahead, you go ahead.
Yeah. Well, I think, see, here she's talking about the husband having a psychiatric condition. So that has no relation, I mean, to the autism from a genetic point of view. There were some old studies that thought that psychosis and autism were linked, but no more. So the clear thing is that I think if there are no other risk factors, then I think, of course, they would have to be seen and evaluated clinically. We can't really tell them on a platform like this that go ahead, but there's no reason why they can't. So, I would ask them to seek an opinion from whoever they want and then take a call.
Okay. Wonderful. Before we end our talk or discussion over the fear for having a second child, just one very simple question for both of you professionals. I have attached specifically the word fear with the second child. Do you feel that I'm justifying the topic from the parents' perspective?
Absolutely, you are. I think most of those fears are natural, but most of the times they are unjustified.
Yes.
And I think in the majority of cases, I mean, of course, this is not for everybody, but once you reach a diagnosis, you can come, there are many ways of reaching a diagnosis nowadays with technology. And if you want a second child, most of the times you will be able to do it. In most of the cases, your second child, will be a support, yes, but not because he's forced to, because he wants to. And I think sometimes, of course, things go awry, and you really can't be sure about anything in life. But I think if you plan, I think the positive message I want to give is that most of the time, second child will change your life.
Yes. True. Dr. D'Souza, your take over the topic.
Well, I definitely agree that yes, fear is the right word. I mean, there is fear, there's anxiety, there's a lot of things that are linked to it. I think I mean, I would even say, even when it comes to say couples with children who are normal or typical, there's so much of planning that goes into a second child. So all the more when you have a special child born out of the first pregnancy, it will all the more be there. And as Dr. Udani said, parenting is something we're not taught. And I will just say something that by the time we start parenting and learn and we realize our parents were right, we have children who are ready to rebel against us. So that's what, invariably happens. Yeah.
Yes. We are like caught. We are in a caught situation when we have our children ourselves doing the same things we did with our parents. Very truly said, very correctly said.
I
Yes, Harshali, madam.
Yeah, I just wanted to add. I mean, just as a parent, just wanted to share, not add. As a parent, because I have two kids on spectrum, and I mean, just for the parents, because this question came in various time towards me, and I was not able to answer this. That's why actually I kept this panel discussion topic, that okay, how to go about it. In my case, what happened is, like, when my elder one was on spectrum, when he got diagnosed, I was already pregnant at that time, and I was not knowing that he's a special child, and I was on my last semester of my pregnancy. So I even thought about it. I mean, okay, जाने दो, जो भी है अभी जो भी है. But I never regretted that thing, because now, after a few years, when they are grown up, I can see the very good bonding in them.
Correct.
And I don't know medically or anything, but I always felt, okay, thank God I have two kids. Even they have autism, but now they are I mean, bit younger. I don't know ahead, but they are good. I mean, bonding is there, and they are there for each other, at least. मतलब ओके, जैसे बड़ा मेरा कहता है कि मुझे बाहर ना खेलने में नहीं ले जाते, मैं इसी के साथ खेल लेता हूँ, because he is not acceptable in society. So he is like, okay, मैं इसी के, ये मारता है मुझे, लेकिन मैं इसी के साथ खेलता हूँ. So that time I feel, oh God, thank God they have somebody. And in normal life also, I feel, when you need some sibling, it's the same way for disability or child. So
Absolutely.
So I feel कि जब अकेला इंसान होता है, तो हमें जब भाई बहन की जरूरत लगती है, वैसे ही why to differentiate in that. Okay, थोड़ा काम बढ़ जाता है parents का to look after, but after all they are our kids. So in my opinion, I never regretted that just wanted to add for parents, actually.
Well said. Well said.
Well said. I think one of the take home messages which I would want to tell parents through your program is, first of all, I have tremendous respect for Dr. Udani. So I mean, it's a pleasure to be on a panel with him. I never get to meet him much in Bombay, though we're in the same city, but it's a pleasure to be on the same panel. But one thing I think, if you see, if you see, most of our answers have been similar. So, what's very important for people to know is consult any professional. The whole thing is it's important. It doesn't matter whether you go to a psychiatrist, a pediatric neurologist, someone who is scientifically equipped. That's very important. Yeah.
True. I completely agree to your point, Dr. D'Souza, that somebody who is a very technical person should be consulted and should be kind of asked the right question. Most of the times, what happens wrong with the parents is they ask the right question to the wrong person. It might be the scenario always, because their curiosity is very high, and kind of their curiosity leads them to a lot of confusion, turmoil, and definitely we understand the state they are into. Definitely a very nice success story presented by Harshali madam herself, also having two children. Somebody had told me about this thing, that on this topic, if you want to get somebody saying appropriate advice or guiding appropriately, it can be the person, don't take me in a wrong way, not about the professional, but a person, a parent who can guide is a parent who doesn't have a child, or a parent who has two children. Not the parent with a single child can compare these experiences. That is what Dr. Sumit had told me earlier, before I began with the panel discussion, and that is so true. That is, I know I can now correlate that why did he say that after our panel has gone so well. Yes, Dr. Sumit? You are on mute, sir. You are on mute.
it was an enlightening session. It is an enlightening session for all the parents, because most of the time the question comes to the professionals, and then sometimes the professional is not that much of equipped. That's why we wanted the professionals who are into the empowerment mode, who have seen the life, who have not just scientific knowledge, medical knowledge, but a humanity you have seen in this in past so many years. So that's why we wanted you, a neurologist and a psychiatrist, from a mind point of view and from the neurology point of view, sir. So I have a one question, sir, just quick question to both of you. Whenever we plan for a baby, we say about distance between two babies, like 1 year or 2 year or 3 years. Mainly in typically in every family they say the 4 years should be the difference. With respect to the first child being a special, when a parent should think that, okay, this is the time that I should go for a second baby, or okay, this is the green signal for the second baby, where they can justify, or we can this thing. What can be that period? Yes.
Do you want me to answer?
Sure, sir.
Yes, sir.
No, I think we discussed this, but I'll just
Yes.
repeat. What I thought is, in typically developing children, your first child, you want at least a 2-year gap, if not a 3-year gap, depending on your age. In special needs first baby, you want that gap to be slightly more. In fact, I would say 3 to 4, even depending on the parents' age again, even 4 years, even 5 years. But the reason being, 4 years would be, because by that time you know where you are with the first child. You have gauged the progress, you know the different issues which are involved, you know what the diagnosis, you probably have an idea what the diagnosis is, those kind of things. So minimum 4 years, I would think. But then depend on the age. So, if you're an older parent, obviously you can't wait too long.
Mostly we take we take 2 ages of the child. One is a chronological age, maybe he's 4 years old, maybe he's 5 years old, but maybe the child is operating from 1 year old of a developmental stage, maybe we can say. So can we say that developmental age of that first baby, or social age of that first baby, should reach to 2 years to 3 years, so that she can understand the next the new baby in the family, and then new baby when goes to the next 2 years, the first baby becomes let us say 2.5 years.
I think it's very difficult to put figures to that, because every patient, every child is different. They have different trajectories of development. Some, may stabilize at a particular age. Some may not develop to what you expect them to do. So it's very difficult. I would not go on that. As a parent, you should realize, okay, this is now usually, 4 years, 5 years is more or less. After that, you have a fair idea where your child is going to be in the future. So that much time you must devote to your first child, give the maximum therapy, you give the maximum attention and all that, so that he doesn't get deprived of his right to get whatever treatments he needs to do. After that, more or less. By that time, it's also given the parents time for acceptance. That 4 or 5 years is a time when they start thinking. But you talk about a second child, the 2-3 years later is very difficult. And the first child's developmental age should not really influence the decision.
Okay.
Okay. Thank you.
Thank you, sir.
Dr. Avinash and Dr. Udani. I would just like to ask any closing notes from both of you. We had an opening note. Any closing notes from both of you, Doctor?
Dr. D'Souza, your choice.
Yeah. Well, all I can say is that, parents of special children have to realize that the key thing in having a second child is why you want that second child. If you want it because you want to love 2 children, then go ahead without thinking. But if you want the second child only because, you want someone to look after the first child, then I think your thinking is wrong. And if you decide to go in for a second child, go in with the same love and affection that you went in for your first child, without thinking about what would happen and what wouldn't happen, and accept all that happens with grace and let life take over.
I absolutely endorse whatever Dr. D'Souza said. I think the why you want a child is the one question all of us need to answer. People like your mother-in-law, father-in-law, this, that, how they are pushing you, get pregnant again, this, that, should not play a role. I know it's difficult for me to say that in Indian society, a lot of things happen, but basically you and the father both have to decide. Because, and this is one more thing, it should not be only the mother mainly who looks after. It should be both. And that's why both of them have to be, ready for that. Because just in case things go badly, and it can happen, you may get a child who's similar because the medical knowledge is not, complete as yet in diagnosing everybody before. Then there has to be a plan B, and that both the parents, it should not be that somebody is blaming somebody else. It should be that both of them agreed, both of them have taken the risk, both of them have understood the risk properly and gone with the eyes open. And I think most of the times, like, you will just succeed in having a very nice second baby. So all the best to all of you.
Thank you, Dr. Udani. So
Thank
just
you
to summarize what both the doctors had shared their opinions about, we started with parents' decision to be the utmost important, shared by Dr. Udani. Also, Dr. D'Souza said that the purpose of the second child should be very clear, why we want the second child. Also, the motivation for the second child, both the children should somewhere be justified. With respect to the early diagnosis of the second child, there are a few factors which are involved, like the brain dysfunction. It can be the genetics, it can be the inherited things from the parents, it can be few environmental abnormalities as well. Also, when we compared that, does the first child have any impact on the second child, we had many queries like, will my second child start copying my the stereotypical behaviors or the repetitive behaviors of my first child? And definitely the second child will help in more acceptance and more love. Also, we went on to the statistics given by Dr. Udani, where he said that definitely there are risk factors involved. But if you see that 80 to 85% risk factor is not there, which actually needs to be considered. Then we went on to the emotional attachment, which is very important to be inculcated from the early childhood, so that the second child will take the responsibility of the first one after the parents are not there. We also spoke about adoption and few guidelines Dr. Udani shared us with respect to the adoption. We also said that acceptance is going to be the key for the parents first, then to the family, then to the loved ones and closer ones. Also, with respect to adoption, Dr. D'Souza said that counseling is definitely a must. Counseling should be considered, and all the ins and outs should be compared. And yes, parenting is the most important job we do, which we should be stuck to. And if we have that inner will to kind of give a lot from our end to the second child, we should definitely go ahead and opt for the second child. Thank you so much, Dr. Udani and Dr. D'Souza, for your time, experiences, your wisdom for all our parents. I'm sure it will definitely, this panel discussion is going to help many families for their decisions. Thank you so much.
Thank you so much for inviting me.
Thank you.
So much, Udani sir. Thank you so much.
Thank you. Yeah, thank you.
Thank you, sir. Thank you.
Thank you.